Imagine getting a blood test result and thinking you have cancer. You go through all the fear and emotions and then find out that blood test was a sham. Today, stunning new details into what was hailed the $9 billion holy grail of medicine that could very well turn out to be one of the biggest frauds this country has ever seen. Theranos founder Elizabeth Holmes mesmerized world leaders and big companies with her vision of running 70-plus blood tests from one tiny drop of blood. But turns out it was all built up on a house of cards that came tumbling down, resulting in what many have reported to be nearly 1 million botched blood tests. Joining us now is the man who broke the Theranos scandal, Pulitzer Prize-winning investigative journalist John Carreyrou. And I remember hearing the buzz about Theranos from a lot of people that I worked with in the medical field. The idea that this device that can be so disruptive, so hopeful, it was inspiring. You almost wanted to believe it was true. What made you question all the hype you were hearing that so many people were praising and you said, not so quickly?
Right, so I had read this long profile of Elizabeth in the New Yorker magazine, and I had been immediately skeptical of the main thesis of that story, which was that she had dropped out of college and come up with this incredible breakthrough that was going to change medicine. I knew from my 10 years of covering medicine that you don't teach yourself medicine in your parents' basement. That said, I might not have done anything with my intuition if I hadn't then gotten a call a few weeks later from a source, a practicing pathologist in the Midwest, and then he passed the tip on to me.
So Elizabeth, just to be clear, was able to raise millions of dollars and rally support for some of the most successful entrepreneurs, leaders in technology. She even had government officials, people we all respect, involved with her company. Now, you make the case that she created a personal persona, that she actually changed herself in order to become what she thought she needed to be.
Right, she did. When she dropped out of Stanford, she was 19 years old. In late 2003, she was actually kind of an awkward teenager, didn't even dress very well, dressed in Christmas sweaters and formless suit pants, and had these Coke bottle glasses. And over the ensuing decade, she really remade herself. She started wearing black turtlenecks like her hero, Steve Jobs. She dyed her hair blonde. She lowered her voice. I think
she lowered her voice.
She lowered her voice. I think that was a response to the fact that Silicon Valley, even to this day, is such a male-dominated world, and she was so young that she felt she needed to do that.
You know, when I read this, and I read your work, I was surprised because I didn't think it made much of a difference. It turns out there's science behind this. And one study showed that in male CEOs, females weren't involved, but probably is even exaggerated in women, a 1% decrease in voice pitch was associated with bigger profits. Think about that. Right, come on over. Let's zero in on the technology that Elizabeth said that she invented. So, a blood test, right, that was fast, easy, painless, just a little finger prick, right, could do it, of blood. It could be tested and reveal help that would change 70 different diagnoses, conditions. 70 different results from a little drop of blood is pretty remarkable. I'm scrolling through a bunch. You may recognize some of these. And usually we, get needles in our arms. It's sort of a big deal. Theranos, if I understand correctly, only had one of these tests approved by the FDA, even though they were all promised. So help me understand how this is even possible that you could go out with a product with no proof and no real permission to be able to sell it.
Right, well, the main answer is that she misled and outright lied to the two main health regulators in this country. One is the FDA, and the other is the Centers for Medicare and Medicaid Services. To give you an example, in early 2013, when an inspector, a state inspector representing both the state and CMS, the federal agency, came to visit the Theranos lab and inspect it and recertify it, Theranos only showed that inspector the top part of the lab where they had just conventional machines testing, and they didn't show them the bottom part of the lab where the shenanigans were going on. That room was never shown to the federal inspector.
How do you hide part of your laboratory when the government comes in? It's
right.
Sort of galling to think you'd even try that.
Right. Well, I mean, that's outright deception. That room, you went to that room by going downstairs, and those stairs were hidden behind a door with a key card. And the inspector never thought to ask, well, what's behind that door? And moreover, the employees at the time were ordered before the inspection not to go down or come up from the room downstairs. Clearly, Elizabeth Holmes and Sonny Balwani, who was her boyfriend and number two at the company, didn't want to attract attention to that room while the inspector was there.
So up next, we're going to hear from a breast cancer survivor who took one of Theranos' blood tests. What she says happened, what's going to make you angry. We're back investigating the Theranos scandal. Now, the whole world was under the spell of this one-time tech startup that said it would revolutionize blood testing with just a prick of the finger. And they promised faster, easier, and cheaper blood draws. My next guest, Sherry, took one of Theranos' blood tests at her local drugstore. She's joining us now via Zoom. Sherry, as a breast cancer survivor, you were checking your estrogen levels. Why did you decide to try this new blood test from Theranos?
Well, it was my OB/GYN who suggested it. The ads were everywhere. They had just expanded into the Phoenix area. Very convenient. Just stop in. You don't have to wait. Do it on your way home from work. It doesn't require an appointment. So that's why I went to Theranos.
So because you're worried about estrogen levels and you're worried about your cancer, you get the blood test, you get the results back. What did the results say that sent you reeling?
What the results said was that my numbers were normal. However, I had 313 PGs per ml of estradiol in my blood. And I went, okay, wait a minute. How can this be normal? I was 57 years old and I was on estrogen blocking treatment. I should have non-detectable estrogen in my blood. So first of all, I was frightened to think, oh my God, I may have a tumor growing somewhere that's producing estrogen. So of course I talked to both my doctors and they both agreed we have to redo the tests. Something isn't right. Hopefully it's not that you have a tumor, but yes, there's a distinct possibility that that's the case.
So in the middle of all this, you're in fear, you're waiting. It takes, I'm sure, days, maybe even a week or more to get the results. How did it make you feel when you got them back after all that fear and realized that the test results were just wrong?
Angry. I was very, very, very angry. And I talked about it a lot on social media. And I started getting, contacted.
Well, I'm sorry it happened to you. I am relieved that you're okay, and I thank you for sharing your story with us. So let's investigate why blood testing is so complex. I'm actually going to get my own blood drawn in an experiment. Investigative reporter John Carreyrou is back, along with Dr. John Cohen, the executive chairman of Bioreference Labs, and June, who is a phlebotomist that I'm trusting. Is that the right thing to do, June?
Yes.
All right. So Elizabeth Holmes stated that investors would, everybody, she stated especially to investors, that people will be able to get results for up to 70 different blood tests just from a single finger prick like this. I'm just going to do it and show you. This was the promise, right? Take your finger, you go to a lab, you don't have to be a surgeon, you can just be there. You see the blood there? Now, I know no one wants to prick their finger, but that's not much to give in order to get 70 test results back. So that's the promise. Now let's pretend that's not right, because actually it isn't, and have June start drawing my blood the more traditional way. So Dr. Cohen, walk me through, how much blood would you actually need in order to run 70 different tests? That's what we're going to be drawing blood for starting right now.
So we were asked to look at the 70 specific tests that you would run. We tried to figure out what was the minimal volume that you could do to run those 70 different tests. And it turns out that it's 16 different tubes of blood.
Oh my, here, give me that tube.
Yes. Okay.
So here's one, all right?
One.
That's how, since we've been talking, there's one. I'll put that in there. We'll put them in upside down here. All right, so you can see the blood's coming out. I mean, we got a while to go here. And in order to fill up enough blood, it's a pain in the neck for me, but at least I'll get accurate results. Now, John, you reported that Elizabeth had very specific criteria.
Right. She was, as we said earlier, obsessed with Apple, and she wanted the device, which the last version of which she called the Mini Lab, to be pretty and especially to be small. When they went live with the blood test in 2013, they had a completely malfunctioning prototype.
We're at 3 now, by the way. So I got a while still to go. You say it's pretty difficult. I mean, as an expert in the space, how feasible is it to do all of this in a little tiny box that John is describing she demanded from her staff?
So let me use an example. Let's say you're going on vacation with your children or your grandchildren. You got 8 pieces of luggage, and you've got a stroller, and you got a car seat, and your share ride shows up in a Mini Cooper. Right? It doesn't work. The math doesn't work. You can't possibly get that many testing into one box.
I'm at number 5, by the way. Theranos, we know, voided nearly 1 million blood test results. 1 million! It's a lot of people that are hurt. So as I get my 6th test blood, I'm not even halfway through what we need to do. The whistleblower who saw blood tests fail firsthand, is here to speak out. We're back investigating the Theranos scandal. Last year, the company's former leaders, Elizabeth Holmes and her number two, Sunny Balwani, were charged with fraud. They promised easier, cheaper blood tests with just a prick of the finger. But there were some people who worked for Elizabeth and Sunny who knew the technology didn't work and worried the false promises could hurt people's lives. Let me bring in a Theranos whistleblower who risked everything, and I mean everything, by secretly reaching out to government regulators. Erika Cheung was a lab associate at Theranos who joined the company right out of college. She joins us now via Zoom from China. Erika, thank you for being here. When did you start to realize there was a problem with the very technology that Theranos had promised it had?
I first realized a problem when we had taken in a patient sample and we were testing them for TSH, which is thyroid stimulating hormone. And we ran the patient sample and it had shown that they had hyperactive thyroid. And just to check it again, we reran it again, and it showed that it had an underactive thyroid. And we ran it again and showed that it was normal.
So the same blood sample from the same patient is either too much thyroid, not enough thyroid, or the exact right amount of thyroid. So obviously, you could roll the dice and get the same kind of result. Now, Elizabeth's number two was Sunny, who was known as the enforcer, despite not having any formal training in lab work, and he oversaw the labs. Erika, you say that you watched the Theranos technology malfunction repeatedly. You just gave us an example. What happened when you alerted him and others at the company?
He had essentially said, what makes you qualified to make that kind of call? Don't ask any questions. You're not qualified to make those calls.
And how did it make you feel when he dismissed what you seem to be articulating, which are very reasonable fears?
Yeah, I found it kind of funny, to be honest, because if we were going to play a game of who was qualified, I mean, Elizabeth Holmes had dropped out of Stanford at age 19 to start this company. And even Sunny himself was not from the healthcare industry. So I found it kind of a little jarring that they would use that kind of logic with one of their own employees when the head leadership, technically, if we wanted to play by those standards, was not qualified to be making those calls and decisions.
So you say there was a culture of fear, of extreme secrecy at Theranos. How did the management keep a lot of their own employees in the dark about their tests?
They put up physical barriers. There were parts of the labs that would be sectioned off. Every single email was being watched by Sunny and Elizabeth. There would be instances where we would send out an email, not CCing Sunny or Elizabeth, and they would respond. So we knew that they were watching every single one of our emails.
So you take this risk when you notify the government, and with the evidence that you offered, the clues, frankly, that you gave them, when they went back and investigated Theranos and found all the things that you said were actually happening, how did that make you feel?
Being in a culture where you were constantly believed that there was something wrong with you and that you weren't qualified, you were too young, you didn't know what you were talking about, it did feel, I was satisfied with the fact that the truth came out, that no more patients were being processed, and that was really satisfying to come to that conclusion.
Well, you should be very proud. The truth is the truth no matter what age you are. Erika, thank you very much, and thank you for what you've done.
Thank you.
So Erika is one of the brave sources of investigative journalist John Carreyrou, who blew the top off the Theranos scandal. So you've talked to a lot of people around her, people who know her well, colleagues, family, friends. What's she going to do next? What she's up to? What's her next move?
Well, she's preparing her defense. I'm told she's in frequent contact with her attorneys at the White Shoe law firm Williams & Connolly. You have to remember that she's now facing criminal charges, 11 criminal charges of wire fraud and conspiracy to commit wire fraud. She faces as many as 20 years in prison. What I also know, and what what other journalists have been reporting, is that she's been going around, gallivanting around Silicon Valley and San Francisco with Billy Evans, her new boyfriend, attending dinner parties. She and Billy and their dog Balto, a husky, were going to Burning Man on the day that her company was being dissolved last fall.
So we reached out to Elizabeth Holmes for a statement, and her lawyer said they have no comment at this time. We also reached out to Sunny Balwani for a statement, and his lawyer said they had no comment at this time. So John, a lot of people are fearful that she will avoid any punishment. Ultimately, she's going to get away with it. Do you think that justice will really be served? I mean, she's gone off to festivals when her company, which took a lot of money with it, was dissolved.
I mean, anytime a case goes to a jury, you never fully know. You can never guarantee the outcome. But I think the evidence that the government has amassed is considerable. We're talking about 18 million pages of evidence and of witness testimony. And I do think that ultimately a jury is going to convict her, perhaps not on every single count, but on some counts. And I do think she's going to do some prison time. We'll know probably beginning of next year. That's probably when the criminal trial is going to take place.
Thank you very much, John, and for your work as well. I know it took a lot of effort, and you were threatened with litigation as well. It was not easy.
Thanks for having me.
Read more about the scandal in John's national bestseller, Bad Blood, which is in stores now. And guess what, audience? Since you're all so enthralled in this, as I am too, you're all going home with a copy. I'll take one also. Thank you for watching. Don't forget to subscribe and turn on notifications so you never miss out on new videos to live the good life.